ladies and gentlemen, friends, very good evening to one and all. Firstly, I'm very happy to be here. It is indeed a great honor to be here with honorable and highly respected people who make a difference in people's life. And when I heard that 30% of cancer is preventable, I think that will create more passion in us to prevent our fellow being from having cancer. So I think this marks the significance of this event that you have today. I'm very pleased to be here with you at the launch of Singapore's celebration of World Cancer Day 2013. As mentioned earlier, it falls on February 4 every year and is celebrated around the world to improve general knowledge around cancer and dispel myths and misconceptions about the disease. According to the World Health Organization, WHO, cancer is responsible for close to 13% of deaths globally, accounting for 7.6 million deaths in 2008. In Singapore, cancer is the leading cause of death, accounting for up to 30% of total death in 2011. The top two leading cancers for a period from 2006 to 2010 were colorectal and lung cancer among Singapore males and breast and colorectal cancer among Singapore females. One of the great myths of cancer is that it cannot be avoided or prevented, and it is part of a person's destiny. The truth is that the number of cancer cases can be reduced, and many cancer deaths can be prevented. You can reduce your cancer risk by consuming a diet rich in fruits and vegetables and less animal fat, or not using, for one, you can also not use too much of tobacco or at all, limiting alcohol use, maintaining a healthy weight, and being physically active. Going for age-appropriate screening for early diagnosis is also important in reducing the number of deaths caused by cancer. Cancer screening helps detect either precancerous lesion or diagnosing the cancer at an early stage. Diagnosing cancer early is important as early stage cancer is easier to treat. In contrast, delaying diagnosis until such time the cancer has progressed to its later stages usually results in more complications and poorer survival rates, as the cancer might be difficult to treat or will require more aggressive treatment. Based on the recent reports from the Cancer Registry of Singapore, 96% of breast cancer cases diagnosed at stage 1 survive 5 years, compared to 88% at stage 2, 58% at stage 3, and only 25% for those at stage 4. Similarly, for colorectal cancer, the survival is better with earlier diagnosis. For colorectal cancer cases, the 5-year survival rate was 79%. For colorectal cancer cases diagnosed at stage 1, compared to 68% in stage 2, 50% at stage 3, and only 7% at stage 4. So as you can see, the percentage reduced stage after stage. So the earlier is detected, better it is. Unfortunately for Singaporeans, the majority of the colorectal cancer cases were diagnosed at stage 2 or later. Appropriate screening together with appropriate management can improve health outcomes and chances of survival, delay or prevent dependence, and reduce the financial and emotional burden on the individual, family members, and friends in the long term. I strongly urge everyone to go for age-appropriate screening to detect cancer early for easier management. I think it needs a community effort. I hope together we can encourage our friends, family members to go for screening, so that we can detect early, and best thing is to prevent cancer. The Health Promotion Board, HPB, runs established screening programs for breast cancer, cervical cancer, and colorectal cancer. These programs provide subsidized screening for eligible Singaporeans. However, less than half of Singaporeans have gone for recommended cancer screening. According to the National Health Survey 2010, only 2 in 5 Singaporean women aged 50 to 65 years had undergone mammography within the last 2 years. For cervical cancer screening, only 48% of Singapore women aged 25 to 69 years had a pap smear within the past 3 years. As for colorectal, in 2010, showed that only 1 in 5 Singaporeans aged 50 to 69 had a fecal occult blood test, FOBT short, within the past 1 year, or screening colonoscopy within the past 10 years. We hope to see an increase in the uptake for colorectal cancer screening in the future with the implementation of the National Colorectal Screening Program in July 2011 as part of the Integrated Screening Program. I strongly encourage all of you and our fellow Singaporeans aged 50 years and above to go for colorectal cancer screening. The Ministry of Health has programs in place to reduce barriers to health screening. The fecal immunochemical test, FIT, in short, screening test for colorectal cancer is provided free for eligible individuals aged 50 years and above chronic disease management program, registered GP clinics under HPB's Integrated Screening Programs, in short ISP. Individuals aged 50 years and above going for screening colonoscopists may also use their Medisave to offset the cost of the procedure. Singapore women aged 50 and above are strongly encouraged to go for 2-yearly screening mammography for breast cancer. Subsidized mammography for eligible women is provided by the polyclinic. Medisave may also be used to offset the cost of screening mammograms. For cervical cancer screening, eligible Singapore women can enjoy subsidized pap smear at polyclinics. For those aged 40 and above, there is also the option of being screened at CEMT registered GP clinics. So as you can see, there are so many screening programs. It's all laid out there for us to help our fellow Singaporeans to ensure that they benefit from it. I hope together we can encourage our friends, relatives and neighbors to go for such screening. In the past, receiving a cancer diagnosis was like receiving a death sentence. But today, this could not be further from the truth. Advances in understanding cancer risk and prevention, early detection and treatment have revolutionized the management of cancer, leading to improved outcome for patients. The key is early detection and age-appropriate screening. I strongly encourage all of you to take advantage of these affordable screening programs. Remember, early detection saves lives. MOH will continue to work with partners and stakeholders to spread this message and explore how to make screening more pervasive. While our colleagues in HPB and the community focus on prevention and early diagnosis, our colleagues in the tertiary institutions have not been resting on their laurels either. Clinicians and researchers in Singapore are working hard to find more effective and safer ways to treat cancer, as well as to improve service delivery to patients. At the National University Cancer Institute, Singapore, NCIS in short, suitable patients with certain types of cancer are now given the option of receiving stem cells transplants on an outpatient basis, reducing and in some cases totally eliminating the need for hospital stay. This is a win-win situation. Outpatient treatment costs less than inpatient care. And very importantly, patients are able to recover in the comfort of their own homes. Outpatient care also frees up more beds and requires less manpower, which permits the hospital to redeploy such resources more effectively. Researchers at NCIS have also made discoveries such as new drug combinations that increase the effectiveness of chemotherapy on tumors. These innovations in cancer care would not have been possible without close cooperation between doctors, nurses, allied health professionals, healthcare administrators, and the pharmaceutical industry. Highlight the importance of collaborations in healthcare. Cancer care is a spectrum that spans awareness, prevention, early screening, and good clinical care. As you can see, it's a process. The more aware you are, the better it is. And this also will need you to take on preventive action by doing early screening. And if you happen to have it, it is good to go early for clinical care. I commend NCIS, the Health Promotion Board, and the Singapore Cancer Society coming together to organize this World Cancer Day event, as well as various outreach activities to raise awareness of cancer in the community. I hope to see more of such campaign in the future. It's like playing the drums earlier. When you play the drums, when you seldom play, but once you go into the beat or play the drums together, this will set the momentum going, and this will help us to have early detection and prevent cancer in the years to come. All these efforts are very, very critical for us because we want to save every Singaporean and every human soul we have in the world, because it means a lot to us as human beings in this world, to make the world a better place for all of us, for parents, for family and friends, as well as fellow Singaporeans. I would also like to thank all residents of the Northwest and Southwest CDC who have shown their strong support for the cause of being here today. The presence makes this event all the more meaningful and lively. On that note, I'd like to thank you, and I wish everyone a pleasant evening. Thank you.
Thank you very much.